they're trying to identify those feelings, but it's really important for them to share it with their caregiver, because that's the main thing. We see them for what, 50 minutes a week. When they go home to caregiver, we're hoping to give that caregiver all the tools that they need to practice everything that they've learned in the home setting. So sharing those, helping them share those emotions, identifying them, that's really important in the and that affective modulation skills. And then the cognitive, again, we're connecting it. We're trying to reframe that negative thought. Sometimes it's the core beliefs that we're trying to help them reframe. Sometimes it's maybe a color that is attached to the event. I had a kiddo who caregiver came in and said, you know, I had ketchup on my cheek, and he reacted. And we went over that session, we did a triangle. So in the event, the child made that connection of ketchup is red. He discovered father's body on the floor, and the blood from father, his trigger is red. And his trigger is safety of his caregivers. So you put those two together, and of course the kid had an episode just seeing the ketchup on her cheek. So we did the triangle, and we did connect those thoughts, feelings, and emotions for that kiddo. So the main thing, and I wanted to share, is the TF-CBT practice components. For me, the most important things that I like to get through for our kids is that PRAC. If I can get through that PRAC, and there's no telling how long that's going to take. That could take maybe 3 to 6 sessions to get through the whole PRAC, and maybe more. Maybe it was an event that was more traumatic for the child. But if I can help with the psychoeducation, normalize their emotions, normalize their reactions, help them self-regulate, feeling comfortable talking about some really uncomfortable things. If I can help them identify, share those emotions with caregiver, and if I can help them connect all of those negative thoughts and kind of reframe them, then that is a really good start to processing that trauma in order to get them to the natural grieving process. Again, average length, 12 to 16, but even though there's a beginning and a middle and an end to this treatment, it could be longer than that. It depends on the individual. It depends on the story. The goals to improve the symptoms related to PTSD, depression, anxiety, behavioral problems. Again, this can be, I know we say the 12 to 16, but it can be anywhere. I've had a client for a year now, and we're still in that PRAC. But I understand because of the trauma that we are still working on it. It doesn't mean that he's not doing the work. It just means that it's more difficult. Essential components, again, engaging that caregiver with the child's treatment plan. That is so important. Again, we are with these children just for a minimal amount of time, and the caregivers are at home and hopefully facilitating all of the learned skills, all of those learned tools, whether it's breathing, whether it's, you know, sharing, all of those. Thank you. Okay. Okay, all of those skills, hopefully they are able to facilitate at home. The joint parent sessions, it's important again. We do the joint parent-child sessions. That's important because it's helping those caregivers facilitate the healing. It's helping them learn how to praise any type of movement that the child has had with the treatment. Again, provide over 12 to 16 sessions. Usually what we'll do is the first 8 sessions are the trauma-focused. Again, getting through that PRAC is really important because we want to make sure that they can get through that PRAC section in order to get to that transition into the natural grieving process. Psychoeducation, again, sharing these resources to the family situation, normalizing symptoms. Sometimes, and I will say caregiver, at the center, sometimes they will say parent, but I choose to say caregiver because sometimes it's not a parent. Sometimes it's foster. Sometimes it is an aunt. Sometimes it's grandparents. So helping those caregivers normalize some of those symptoms. Again, the relaxation, learning or helping the kids learn to self-regulate, breathe. Sometimes they're just sitting there, and when they're at the center, they know that when we're at the center, we might be talking about the death. And it's triggering for them just to even step in that center. And so I praise them for being here. I praise the caregivers. Thank you for bringing them. Because this is where they talk about it, and we want them to feel safe. Feeling safe, talking about those really uncomfortable things, and that's our job, is to help them feel safe. Again, the affect modulation, it's assisting and helping that child identifying those feelings that they have, and it's helping them with the I don't knows, and everything is in there, and helping them get that out, and so they can see it. We do a lot of expressive art interventions because they can see it, they can feel it. If we're using paint, they can smell it. So we want them to use everything that we can give them in order for them to identify all of those scribbles that they have inside. And I call those the I don't know, the I don't knows. When a kid says I don't know, it's so real. So that's what I'm with the affect modulation. All right, there are some, I'm not sure if you got some handouts, but these are some of the handouts that we use for this. They are on the website that I have attached to the resources. So helping young children with traumatic grief, there's some tips for the caregivers. Sometimes I have caregivers saying, I don't know what to do, and they ask me this, what do I do? And so we help them identify what are the symptoms and how can we help them. Helping teens, again, the difference between helping a little and a teen is completely different because they're going to be processing things differently. Even at the center, we'll have different interventions working on the same task, but teens are going to process things a little differently than the youngers. And then the trauma-focused, that is just the basic, how do we adapt trauma-focused CBT with the childhood traumatic grief. So that is there also on the website. And then sibling death. And that is really good information also for the caregivers because sometimes caregivers are going through their own trauma. So they have the loss of a child, the child has a loss of a sibling, the whole dynamics of the family has changed. And then depending on whether this was a violent death, was it a traumatic event, that just adds layers to that event. So relaxation, there are some things that we do in order to help them relax. We do calming jars, we do the 4-7-8, we do progressive relaxation techniques, we do meditation, and sometimes we'll try it and it doesn't work, and that's okay, because there's always something for everyone. Yes?
Can you explain the calming jar?
Yes, I will. I'm going to show you a video, and then we'll explain that for you for sure. So the calming jars we use, I'm going to show, actually I'll just show the video right now.
I get really mad when my brother hits me a lot.
I don't like it when you say you don't want to play with me.
When I'm mad, my brain can get a headache and it can start hurting.
Your blood keeps pumping because you're like really mad. And you start to get sweaty because you're getting really, really mad. And then when you start getting really mad, you turn red.
When your body can't really control yourself, mad just takes over your body. I just get out of control. It's kind of like if you had a jar and then the jar would be your brain, and then you put glitter in the jar, and that would be how you would feel like. If you shook up the jar and the glitter went everywhere, that would be how your mind looks. And it's like spinning around, and then you don't have any time to think. and you sometimes punch stuff and people when you don't really mean it. When I get angry, I feel it in my heart. I really don't like when I get angry. The amygdala really reacts, but the prefrontal cortex tries to keep it down. When I feel like I want to, get really angry and yell, I just sometimes, take deep breaths. First you find a place where you can be alone, then you find some way to relax and calm down. When I need to calm down, I take deep breaths. I breathe in through my nose. Sometimes I close my eyes or just take deep breaths.
It's calming down, it's not moving. It's slowing down and then it stops. And the heart plumps slow and then it goes into your brain.
It's like all the sparkles are at the bottom of your brain. My brain slows down and then I feel more calm and then I'm ready to speak to that person.
This is the video that I use for the kiddos before I do the calming jars. There's something about this video that kind of calms them. They see that I had a kiddo say, it's like all of the bad feelings are going down and it's just leaving me with the good feelings. So we're going to show you, Kim and Keely are going to show you some of the calming jars, my Dallas Cowboys.
So I had a kiddo that I saw last week who is having nightmares, traumatic-induced nightmares, and we created a jar to help the kid, and I'll pass this around so y'all can shake it up and watch it, to deal with his nightmares. So when he wakes up in the middle of the night and his nightmares are zombies getting him, he can take that jar, shake up his zombie juice and say, zombies, go away. And then he's got a visual stimulate that helps de-stimulate him so he can relax and actually help self-regulate from these dreams. He's not always having dreams. He's just waking up in the middle of the night often and is associated with nightmares. So the jars are basically clear Elmer's glue, food coloring, and glitter. And the slower you want the glitter to go, the more glue you put in, a little bit of water. For all of you, as you're passing it around, shaking it and just watching it, you'll see how it does have a very soothing effect on you, and you're just a little bit lost in the glitter. It's like your own personal snow globe.
So you can take it a step further. Earlier, whenever Marcella was talking about the affect modulation and them picking the colors to go with their feelings, you could even do that with this calming jar. So if you have different color glitter, the angry could be the red glitter. And then, and whatever color they choose, and then you can tie that in together with the relaxation.
So,
what did you say the ingredients were in the bottle?
Clear Elmer's glue or generic glue, water, glitter, and food coloring if you want.
Just make sure the water is warm.
Mm-hmm. Yeah, so it actually melts into the glue. And you can decide the level. You always want to do at least half the bottle of glue. If you do less than that, regardless of the bottle size, you're not going to get a good consistency out of it. Half the bottle with glue. Fill half the bottle with glue. So you can use those little 8-ounce water bottles, you know, the ones that we have everywhere. You can use those. Just take the wrapping off the outside, and it has the same effect.
The bottles that I use that you're seeing, I have not used any food coloring, but you can use food coloring also, and that kind of helps make the color for them.
So next we're going to do a breathing technique. When you have a child that you're in session with, or if you're working with a group of kids and you see that they're having trouble regulating themselves, this is a great breathing technique that can help you calm yourself, just in case you might be having a little countertransference, or also helps the kids relax. When you do this, you're going to inhale for a count of 4, hold for a count of 7, and exhale for a count of 8. When you exhale, I want you to visualize your mouth being the needle that pumps up a balloon or a tire and slowly pushing the air out so that you're not going, you want to do a very slow leak. So we're going to do this together. So I want you to feel it so that you can do it yourselves. So if everyone would put their feet flat on the floor and close your eyes. The reason we're closing our eyes is because we're going to let all the air go into our bellies, and we don't want you staring at each other's bellies. So we're going to go ahead and inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and exhale, 2, 3, 4, 5, 6, 7, 8. Again, inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8. One more time, inhale, 2, 3, 4, 5, hold, 2, 3, 4, 5, 6, 7, out, 2, 3, 4, 5, 6, 7, 8. So everyone should be a little chill now.
There's actual research that states that with doing this exercise, it actually slows your heart down. So if they say I'm having trouble sleeping, 4, 7, 8 will help with that also. And I always say, just deflate. And they're like, oh, okay, Miss Marcella, I'm deflating.
So another technique that works really, yes?
I just have a quick question about the glitter bottle real quick. How do you, I'm just picturing this in my office. How do you set it up? Do you have water bottles that are already prepped with just like glue, and then they pick their glitter?
I have the water bottles already prepped with warm water. I let them, the movement of creating it themselves is also very therapeutic. So I will have the warm water in my office already. We have an art room at the center, and we can use it there. But if I'm in my office, warm water already set.
So they pour it into the bottle, they pour the glue.
Yes, it's that movement that they have in creating.
They pick out the colors of glitter, how much glitter they want to use. Part of them putting the glue in is also a great experience for you as a clinician to be able to go, when they go, oh, it's too hard, I don't want to do it, you do it for me. Well, let's do it together. Or, you know, I know that seems hard, but this is a hard process. You know, you can make all kinds of connections with it. And I did have somebody that was, it was just too hard to squeeze the glue into the bottle. It wasn't, but, you know, it was. So it was a great bonding experience for us, for them to see how far they could push me to, or, you know, to get things out of me and that kind of thing. There's all this great transference with it.